Welcome to today's episode of Rural Health Pulse. I'm your host, Dr. Jim Kinnear. On this episode, we're joined by Nicole Stallings, President and CEO of the Hospital and Healthsystem Association of Pennsylvania, or HAP. We'll be talking about the work of HAP and the current state of hospitals in Pennsylvania, particularly rural ones, and the challenges and opportunities ahead for our healthcare system. Nicole, thanks for joining us and welcome to Rural Health Pulse.
Thank you for having me.
It's real exciting to have you here, and thinking just to get started, for listeners who may not be familiar, would you mind giving us a high-level overview of the Hospital and Healthcare Association of Pennsylvania and its core mission?
Sure. HAP is the advocacy organization for over 235 hospitals and health systems in the Commonwealth. That means we are advocating for policy change in Harrisburg and in Washington, D.C. to help our members support their communities. We also play a key role in convening. We pull our hospitals together in an all-teach, all-learn environment and really dig in together on some of the key challenges facing healthcare delivery and also impacting the health of the communities that our hospitals serve. Those could be things from workforce shortages to maternal health or even around emergency preparedness.
Really found that interesting how you described that all teach, all learn model. So really is a lot of hospitals working together and how to leverage the knowledge and expertise of each other.
And as an advocacy organization, we are strongest when we're speaking with one voice. So we take a regional approach to a lot of the policy development we do. I find that I'm often in my car driving across the state, meeting with hospital leaders to understand what their key challenges are, and then coming back to our team and through our board, developing that advocacy agenda on behalf of all of the state's hospitals.
Well, that's fantastic. Just so that our listeners know a little bit more about you as well, could you share a little bit about your professional journey and what brought you to HAP and what experiences have shaped your approach to your leadership in that role?
My professional career has been a pretty straight path, really starting with my passion for improving health for communities. But I'll go a little before that. I was a first-generation college student, and when I was in undergrad, I found that I was doing a lot of volunteer work for different organizations like Legal Aid, going into rural communities and helping families enroll their children in what was the CHIP program, or working to help elect people that I believed were like-minded. And as I progressed and continued with graduate school, I had an opportunity for an internship. I'm such a believer in internships and mentorships. My internship at the New Jersey Hospital Association continued to get extended. And by the time I was ready to graduate, I said, you're going to have to offer me a job or I'm going to take one with all of these people that I've met over the past year. And I got a policy job at the New Jersey Hospital Association, and the rest was really history. And so I worked there and then moved to Maryland and worked for the health department. I was a policy advisor for 2 health secretaries during a time of incredible health policy change, the Affordable Care Act, Medicaid expansion, really innovative ways, standing up a patient safety center in the state. I really got to have my hands on all of those key initiatives. Started working for the Maryland Hospital Association for almost 12 years. And then this opportunity to come and lead the hospital association here in Pennsylvania opened up. My husband was born in Pennsylvania. All of our family is in Western Pennsylvania. So it was a no-brainer. And so in many ways, we're coming back home. And I've now been in this role for almost 2 years.
Well, fantastic. Thanks for sharing that. And that was really interesting to hear how you've had exposure to different states and different organizations and how you can bring that experience now to HAP as well. And love that local connection and local roots, and it's always great to come home. You mentioned earlier about HAP's role with advocacy. Since our audience is focused on rural health, what are some of the specific advocacy efforts or policy priorities HAP is championing on behalf of rural hospitals and health systems?
When we think about what the key challenges are for our hospitals, be it financial sustainability, workforce shortages, the regulatory environment in which they are operating, we know that those are all particularly acute challenges for our rural hospitals. Right now, more than half of Pennsylvania's hospitals are operating in the red, and a third have had multiple years of losses, and that's just not sustainable. We are, of course, especially concerned when we look at what's happening at the federal level with proposed Medicaid cuts. Right now, rural hospitals receive 74 cents on the dollar. Any additional cuts to Medicaid reimbursement would further strain hospital services and potentially put at risk the ability to keep doors open. The truth of the matter is that reimbursement right now does not keep up with the cost of providing care. And we think about rural hospitals that have high fixed cost, that are predominantly reliant on Medicaid and on Medicare. And the payment model isn't working. So we need help from our federal partners in not reducing Medicaid reimbursement, but in fact increasing it. We need to think about new payment models for rural hospitals. We also need to think about the ability to be able to invest in capital improvements with many facilities that are quite old. And of course, we're doing this in the midst of persistent and historic workforce shortages, which are increasingly severe in our rural hospitals. We know that it is difficult to recruit individuals into rural communities. You are more likely to be able to build a team of caregivers in your hospitals and rural communities if they come from rural communities. And so our advocacy agenda includes things like looking at loan repayment and incentives to bring people to rural and underserved areas, but also supporting economic development in rural communities so that people want to stay in the communities that they came from. And then, of course, we have to look at the regulatory environment in Pennsylvania. The hospital licensure regulations have not been updated in 40 years, and so they're not reflective of how care is provided today, and they certainly don't take into account the unique needs of our rural hospitals. These things are just a few of the pillars of our rural advocacy agenda.
Thanks for sharing that, Nicole. And as I was listening to you, one of the things that occurred to me is that larger healthcare systems may have more resources to advocate for themselves and to address some of those challenges, but small rural hospitals just don't have the same bandwidth. And having an organization like HAP to have that collective voice and focus is so important to address those challenges.
Yeah, HAP is the voice for all of Pennsylvania's hospitals. The mission is the same, but you're right, resources are variable. I brought to my board last year a concern around access to care in rural communities and really put the question to them of, can we make this a priority? Can we have an advocacy agenda that's targeted to a subset of our membership, which is acute care hospitals, specialty hospitals, long-term acute care hospitals, behavioral health hospitals, and they all agreed, yes, we need to sustain access to services across the Commonwealth.
I know another area that HAP is working on is trying to address public health outcomes across Pennsylvania. Can you share a little bit about your work in that area?
We know there are so many things that are outside of your traditional medical care that impact your health. And so HAP has been very focused on those social drivers. And when I think about rural communities in particular, of course, one of the things that comes to mind is transportation. And so this is a key area that HAP is focused on, not just looking at EMS and that workforce, but also other opportunities to help transfer patients between hospitals. I often hear from hospital leaders that you'll have a patient who's from a rural community. They've had to go to a larger hospital, say in a nearby urban area. And when they're ready to leave, that means that their loved one is having to take off work, arrange transport to go pick them up and bring them back. And so these are the realities of our patients and our family members that live in rural areas that we need to address. But when we think about public health more broadly, it's really about health of communities and the way in which we are partnering outside of the four walls of the hospital. And there are countless examples that we are focused on, from children's health to maternal health, and really building an agenda around that.
I also noticed that HAP is very involved in ways to drive innovation and to help spread best practices. And earlier you mentioned about the model where everyone teaches and everyone learns, and I'm sensing there could be a connection between those things.
Yeah, when I first started my career at the Maryland Hospital Association, I was working in our quality department, and I was leading initiatives around readmissions and HCAPs and really building collaboratives across the continuum. And I learned then that capital C collaborative, that IHI model, and really bring that to a lot of the work that we do. There are so many opportunities to bring hospital leaders together to share the things they are doing to improve the health of their communities. The first that comes to mind for me right now is a significant priority, and that's around maternal health outcomes. So last year, we were seeing the rates of maternal health complications increasing. We are seeing high rates of disparities, and our board directed our team to make this a priority. We pulled a task force together of quality and clinical and administrative leads, and for a year really looked at the problem and what are the things that we should be doing, and released a report in January of this year that is outlining the next several years of work that we at HAP have to do. That report includes recommendations for our hospitals. I call it holding up the mirror, really evaluating where care can be improved and the investments and systems that you need to have in place. Opportunities for policymakers, policy change and investments that need to happen. And then HAP is kind of in the middle because we have to support our hospitals and their work, but we have to influence and advocate on behalf of our hospitals to those policymakers to get the appropriate policy change and investments. This work has already started with, been shot out of a cannon, so to speak. We have already launched monthly webinar series where we're taking best practices month by month and bringing clinical leaders together and providing them an opportunity to share. It shaped our advocacy agenda. We will be pulling together a maternal health summit in the fall to, again, bring everyone together. We know that this is going to be a multi-year undertaking, but it will continue to be a priority of sustained and meaningful work.
One of the things I heard there that I found very interesting was this multifaceted approach of looking at what resources hospitals and health systems need and advocating for them, but also encouraging them to be transparent and look at themselves and where they can improve and also learn from each other in terms of best practices. So really trying to look at that issue from all areas.
Yeah, and quality improvement is continuous. You're never done. You're consistently identifying where you can do more, do better. That's very similar to association work. We are never done in the work that we need to support our hospitals. And I think maternal health is the right priority for us right now.
I know one of the other pressing issues facing Pennsylvania Hospital is workforce issues, and you mentioned those earlier. Can you expand any more on what HAP is doing to support its members in tackling those challenges?
One of the things that we really need to start with when we think about any significant problem like workforce is the data. And so for the past 4 years now, HAP has surveyed our hospitals to understand what their workforce shortages look like, what are their pain points, understanding vacancy rates at a very detailed level, turnover, but also the initiatives that they're putting in place to help address those problems. So we are still seeing double-digit vacancy rates across all positions in all hospitals in every community. We have certainly made progress since the pandemic, and things that our hospitals are doing, everything from pay increases to bonuses to tuition assistance, even to childcare. Over 30% of our hospitals are providing childcare compared to only 6% of businesses nationally. And I think that's because we really realized during COVID that we had members on our care teams, in particular women, who had to return home to care for children or older adults. And so those are examples of the ways in which our hospitals are looking to address their problem, and we are seeing that it is starting to bear fruit. We have had a 30% reduction in turnover over the past 2 years, but still have double-digit increases. And those vacancy rates, still have double-digit vacancy rates across all of our hospitals. And those vacancy rates are higher in rural communities. So, for example, a 21% vacancy rate for registered nurses across our rural hospitals. So while our hospitals are working to build their own local pipelines, partnerships with middle schools and high schools and apprenticeship programs, we are also looking to policymakers to be part of these solutions. That's where loan repayment comes in, a real focus on faculty, health educators, preceptors, and more, because we know that every year as a country, we are turning away 80,000 qualified students from schools of nursing because we don't have the clinical sites or the faculty that we need. We don't want to get demand that can't be met here in the Commonwealth. And then certainly once we have these individuals in health careers in the hospitals, creating those pathways so that you can start as an LPN and then get support at the hospital to continue your education, become an RN, for example.
When you think about that disparity of there being such a demand for various health occupations, including nursing, and what you just shared in terms of qualified students being turned away from those training programs, can really appreciate how critical it is to address those challenges and help hopefully find some solutions to address our workforce issues and also provide great training, development, and career opportunities for others.
And there's such an opportunity for partnerships. You know, when I was growing up and I would think about a job in a hospital, I thought you either had to be a nurse or a doctor. We have all kinds of roles available in our hospitals. I had a hospital executive tell me they need HVAC as much as they need nursing. We have engineers and health administrators and more. And so when I'm talking about careers and hospitals and our needs, it's really simple. We're hiring.
And it's another great example, too, of that collaboration and working together rather than each hospital figuring out how to do some of these initiatives on their own, being able to share with each other and collaborate and approach some of these things together as well. Nicole, from your very unique perspective, what does the future look like for hospitals and health systems in Pennsylvania, especially in rural areas?
In some ways, I think it's a return to the past. I think that we will see more and more a focus on meeting our patients where they are. And we know that people want to age in place. We will see more innovations like hospital at home and going into people's homes and providing them care that way. Some of the partnerships that existed previously among care providers, I believe, will need to be reinvigorated to really meet demand, especially in light of the shortages that we have. Really thinking about team-based care and ensuring that you are doing kind of the tasks that only you can do and really bringing others to that team. And I also think there's still an opportunity for technology. We're starting to see more virtual nursing, for example. So why does the nurse have to be sitting bedside for discharge instructions when that could be done looking at a screen in your room so that nurse that's on site in the hospital can be where they're needed most with the patient that needs them most? Our job at HAP is to create forums so that our hospitals and healthcare leaders can share what they're doing and kind of try to build that vision together for the future, but that we also clear any policy roadblocks that might be in the way.
So hearing that combination of new and innovative things, but also sometimes things coming full circle and going back to some things that worked in the past and trying those again.
That's right.
We've covered a lot of ground in our conversation. Before we wrap up, is there anything that we haven't touched on that you think would be important and valuable for our listeners to hear?
One of the things that I find that I'm continuing to message to lawmakers is that you cannot have healthy, vibrant communities and economies without a strong local hospital. Those two go hand in hand. So our hospitals are community anchors. They are economic engines. They are job creators directly in the hospital, but then downstream as well with other businesses and contracts. And so I think it's critical to have policymakers really as partners when we think about the future of hospitals and ensure continued access to health care locally.
Well, Nicole, thank you very much for being part of Rural Health Pulse, and thank you for all that you do to help ensure that Pennsylvania hospitals and health systems are strong and viable in the future.
Thanks for having me, Jim.
The Hospital and Health System Association of Pennsylvania is a vital voice for the health and well-being of Pennsylvanians. By working closely with member hospitals, HAP provides advocacy, education, and a collaborative platform to help sustain and strengthen high-quality health care across the state. Rural Health Pulse is a collaborative project of Indiana University of Pennsylvania, Indiana Regional Medical Center, and the Indiana community. This episode was produced by Chris Korn from the IUP Division of the University Advancement and recorded by the IUP Communications Media Department. I'm Dr. Jim Kinnear. Thank you for listening, and be sure to join us next time on Rural Health Pulse.